Welcome. This video contains useful information about the adolescent Tdap vaccine. It was developed for healthcare providers working at Indian Health Service, tribally run and urban Indian healthcare facilities. My name is Dr. Jasmine Curry Thomas. I'm a member of the Navajo Nation and a resident physician in family medicine. I am partnering with Native Boost to bring this presentation to you today. For those of you who may not be aware, Native Boost is a project at the Northwest Portland Area Indian Health Board dedicated to sharing accurate, high-quality childhood vaccination resources with Native people and their medical providers. To access Native Boost's patient education tools, you can visit www.nativehealthresources.com, click on the Resources tab, and filter resources by the Native Boost campaign. This presentation will review tetanus, diphtheria, and pertussis infections, the Tdap vaccine, and current recommendations for Tdap vaccination for adolescents. I will also share information about pregnancy and wound management, as well as useful talking points you can use when speaking with parents and caregivers. Finally, I will offer some additional resources. So let's take a few minutes to discuss tetanus, diphtheria, and pertussis. Tetanus is caused by the exotoxin of Clostridium tetani, a spore-forming anaerobic bacteria that resides in the soil and in the intestines of some animals and humans. Spores enter the body through contaminated wounds and germinate under anaerobic conditions. The resulting bacteria then produce an exotoxin, tetanospasm, or tetanus toxoid, that interferes with the release of inhibitory neurotransmitters, leading to unopposed muscle contraction. In susceptible individuals, muscle involvement occurs in a descending pattern, usually beginning with trismus or lockjaw and progressing to include neck stiffness, difficulty swallowing, and abdominal rigidity. The incubation period is about 8 days, with the range being from 2 to 21 days. Spasms continue for 3 to 4 weeks. Death results from respiratory failure, autonomic dysfunction, including arrhythmia, aspiration pneumonia, and pulmonary emboli. Diphtheria is caused by Corynebacterium diphtheria, an aerobic bacillus that is itself infected with a corynebacteriophage carrying the toxin. The toxin inhibits cellular protein synthesis, causing local tissue destruction and the formation of a pseudomembrane in the pharynx. The toxin also causes other manifestations of infection, including myocarditis, nephritis, polyarthropathy, and thrombocytopenia. Non-toxic producing strains can cause severe pharyngitis, endocarditis, bacteremia, cutaneous lesions, and septic arthritis. The incubation period for diphtheria is 2 to 5 days, with the range being 1 to 10 days. Humans are the only reservoir. Transmission primarily occurs via respiratory droplets. However, transmission can also occur with close contact with skin and everyday objects like toys, doorknobs, and clothing. Prior to vaccination, greater than 100,000 cases were reported annually in the U.S., with 13,000 to 15,000 deaths. With routine vaccination, which began in the 1940s in the U.S., there was a rapid decline in cases. For instance, from 1996 to 2018, only 14 cases and 1 death were reported. Bordetella pertussis is an aerobic bacteria that produces multiple toxins and antigenic proteins that produce clinical symptoms. These components include pertussis toxin, filamentous hemagglutinin, agglutinogens, adenylate cyclase, pertactin, and tracheocytotoxin. They cause harm through paralyzing cilia, causing inflammation and inhibiting the body's immune response. Notably, immunity occurs from natural infection but is not permanent. The typical incubation period for pertussis is 7 to 10 days, with the range being 4 to 21 days. Humans are the only reservoir, and transmission is from respiratory droplets. There are 3 stages of pertussis infection, including catarrhal, paroxysmal, and convalescent stages. The first stage, known as the catarrhal stage, occurs when symptoms are indistinguishable from the common cold. This stage usually lasts 1 to 2 weeks. During the paroxysmal stage, there is a worsened cough with typical paroxysms lasting from 1 to 6 weeks. After this period comes the convalescent stage, which is characterized by a gradual recovery over weeks to months. Complications of pertussis can include secondary pneumonia and neurologic symptoms, including seizures and encephalopathy, either from hypoxia or direct impacts of the pertussis toxin. Infants are most affected. For instance, of 307 deaths from 2000 to 2017, 84% of deaths were infants less than 2 months of age. Prior to regular vaccination for pertussis in the U.S. in the 1950s, in the U.S., there were 175,000 cases of pertussis annually. Regular vaccination has had a tremendous impact on disease burden. From 2000 to 2017, pertussis caused an average of about 2,957 infections, about 1,122 hospitalizations, and about 15 deaths annually in the U.S. Significantly waning immunity among adolescents creates the potential for asymptomatic reservoir hosts. Now let's take a moment to discuss the ins and outs of the Tdap vaccine for adolescents. There are two Tdap vaccines available in the U.S., Boost, Boostrix and Adacel. These contain the same formulation as infant versions of Tdap, Influenza and Dapcel, except the concentration of antigens is lower. Both vaccines contain aluminum as an adjuvant. Neither contains antibiotics, preservatives, or latex. Both Tdap vaccines demonstrate a strong immune response. In clinical trials of Boostrix, 84 to 96% of recipients aged 10 to 18 showed increased antibody response for each individual antigen in the vaccine. Similarly, clinical trials of Adacel show that 86 to 95% of recipients aged 11 to 17 showed increased antibody response for each individual antigen. These increased antibody responses means the immune system is boosted to increase the level of protection against tetanus, diphtheria, and pertussis. Side effects for both vaccines include injection site pain, redness, or swelling. The most common systemic side effect was fever reported by 1.4 to 5% of recipients. Less frequently reported were headache, fatigue, and gastrointestinal symptoms. Ongoing surveillance has found no association between Tdap and specific rare neurologic conditions such as encephalopathy, encephalitis, meningitis, paralysis, seizures, cranial nerve disorders, or Guillain-Barré syndrome. When it comes to vaccine recommendations, to ensure vaccines are safe and effective, vaccine recommendations are continuously updated on new information from disease surveillance systems like the National Notifiable Disease Surveillance System and the Active Bacterial Core Surveillance System, the Vaccine Adverse Events Reporting System, or VAERS, as well as the Food and Drug Administration, vaccine manufacturers, and independent researchers. The CDC Advisory Committee on Immunization Practices, or ACIP, is the body that reviews this data and determines the recommendations published in the CDC immunization schedule. ACIP is a group of clinicians, researchers, public health experts, and at least one unaffiliated community member that meet at least 3 times a year. ACIP meetings are open to the public to increase transparency and public trust regarding vaccine recommendations. When it comes to the Tdap vaccine, the CDC immunization schedule recommends routine vaccination of adolescents aged 11 to 12 with 1 dose Tdap, the adolescent booster. 1 dose of Tdap is also recommended for each pregnancy, preferably in early part of gestational weeks 27 to 36. Tdap is also recommended as tetanus prophylaxis and wound management in persons aged 7 years or older with history of 3 or more doses of tetanus toxoid-containing vaccine. For clean and minor wounds, administer Tdap or TD if more than 10 years since last dose of tetanus toxoid-containing vaccine. For all other wounds, administer Tdap or TD if more than 5 years since last dose of tetanus toxoid-containing vaccine. Tdap is preferred for persons aged 11 years or older who have not previously received Tdap or whose Tdap history is unknown. If a tetanus toxoid-containing vaccine is indicated for a pregnant adolescent, use Tdap. And just of note, Tdap may be administered regardless of the interval since the last tetanus and diphtheria toxoid-containing vaccine. The 2 listed contraindications for use of Tdap vaccines are severe allergic reaction to any vaccine component or following a prior dose, and encephalopathy not attributed to another identifiable cause within 7 days after vaccination. The following are listed as precautions for use of Tdap vaccine: moderate or severe acute illness, progressive or unstable neurologic disorder, uncontrolled seizures, progressive encephalopathy, Guillain-Barré syndrome within 6 weeks after a previous dose of tetanus toxoid-containing vaccine, history of arthritis-type hypersensitivity reactions after a previous dose of diphtheria toxoid or a tetanus toxoid containing vaccine. To recap thus far, we have discussed tetanus, diphtheria, and pertussis infections and Tdap vaccination, as well as current vaccine recommendations for adolescents. Now we will discuss strategies for talking with parents and caregivers about Tdap vaccines and vaccines in general. Notably, suggested approaches and talking points are based on research conducted by Native Boost. In 2024, Native Boost conducted 11 focus groups to gather the thoughts of tribal community members and healthcare providers and clinic staff in the Pacific Northwest. In the end, we spoke with over 58 providers representing 12 tribal and 2 urban clinics and over 44 tribal community members from across the region. Through speaking with community members, we learned that they want to learn the basics about what the disease is and why vaccines are important via face-to-face conversations with trusted medical providers. Thus, when educating parents and caregivers, it is important to take time to discuss what tetanus, diphtheria, and pertussis infections are, as well as the potential consequences of not vaccinating against them. Something to keep in mind when speaking with Native patients is that it is vital to use clear and concise language and to avoid using medical or scientific jargon. During talking circles, many parents and caregivers expressed that they did not understand or relate to medical or scientific terminology. To avoid making their providers feel like they were being challenged, parents and caregivers commonly said they avoided asking questions about concepts or words that they did not understand. So, as a provider working with Native people, when you use medical or scientific jargon, you are missing an opportunity to effectively communicate valuable information with your patients. When it comes to speaking with your patients about tetanus, diphtheria, and pertussis infections and the potential consequences of not vaccinating against them, consider saying something like, diphtheria, tetanus, and pertussis are all serious diseases. Diphtheria can damage kids' hearts and nerves. Tetanus can cause painful muscle spasms. When spasms get to the neck and chest, kids have trouble breathing. Pertussis can cause such bad bouts of coughing that children can choke. In severe cases, diphtheria, tetanus, and pertussis can kill. Thankfully, there are vaccines that can help protect everyone. Then consider letting parents and caregivers know just how effective Tdap vaccines are by saying something like, I let all my patients know that Tdap vaccines are effective. Most children who are fully vaccinated will be protective, and if your child gets vaccinated and then happens to get sick, which is unlikely, their illness will probably be mild. Based on Native Boost research, one of the topics Native parents and caregivers were frequently interested in was vaccine safety, particularly as it relates to Native people. To address parents and caregivers' concerns about Tdap vaccine safety, make sure to let them know that since tetanus, diphtheria, and pertussis can result in serious health illness, we have been regularly vaccinating kids in the U.S. since 2005. Since Tdap vaccines were approved, millions of Americans have safely received the vaccine, including American Indians and Alaska Natives. Make sure to remind your patients that serious reactions to vaccines are uncommon by saying something like, if you feel hesitant about vaccinating, keep in mind serious reactions to vaccines like the Tdap vaccine are extremely rare. You're more likely to get hit by lightning than have a severe allergic reaction to any vaccine. Based on Native Boost research, it's also important to normalize mild vaccine side effects. Make sure to emphasize that after receiving the Tdap vaccine, like any vaccine, kids may experience mild side effects. Consider saying something like, when it comes to the Tdap vaccine, common side effects may include fever or pain, redness or swelling where they got the shot. Mild side effects are a good sign that your child's body is preparing to fight tetanus, diphtheria, and pertussis. Within our body, each of us have warrior cells, also known as antibodies, that stand guard and attack disease. Vaccines like the Tdap vaccine help our warrior cells see and fight disease. For example, when we get the Tdap shot, the ingredients in our shot tell our warrior cells how to recognize and fight against tetanus, diphtheria, and pertussis. Sometimes when our warrior cells are preparing to be able to fight, they cause mild side effects. These side effects are not a sign of illness. They are a sign your child's body is getting prepared, if needed, to fight tetanus, diphtheria, and pertussis in the future. Most mild side effects usually go away within a few days. If anything seems unusual or you are unsure, call the clinic. We can help. To summarize thus far, we have discussed the importance of educating parents and caregivers about the basics, including what tetanus, diphtheria, and pertussis infections are, as well as the potential consequences of not vaccinating against them. Based on our research, we emphasize the need to use clear and concise language, void of medical and scientific jargon. We also offer language that can be used when discussing Tdap vaccine effectiveness and safety, and the need to normalize the experience of mild vaccine side effects. Now we will discuss strategies for sharing culturally resonant messages with parents and caregivers that center a Native perspective. Something tribal community members said would encourage them to get their kids vaccinated when asked about effective messaging around vaccination included the desire for providers to emphasize the benefits of vaccination from both an individual and community perspective. To do so, consider reminding patients that vaccination protects their child and others in the community. Also, remind parents and caregivers of their responsibility to care for one another and for generations yet to come. Finally, make sure you present information about vaccines in a way that honors parents and caregivers' autonomy and individual sovereignty. This includes providing information about vaccines in a non-judgmental, empathetic way that affirms parents and caregivers' experiences while sharing accurate information. As medical providers, it's critical to listen to patients' concerns, take time to share basic information about vaccines, answer questions, address myths, and accept that parents and caregivers have the power to determine the right choice for their child and their family. And to enhance your knowledge about tetanus, diphtheria, and pertussis, and other vaccine-preventable diseases, there are a few resources I'd like to share. First is the Epidemiology and Prevention of Vaccine-Preventable Diseases, also known as the CDC's Pink Book. This comprehensive manual provides detailed information about vaccine-preventable diseases and all vaccines on the CDC immunization schedule. The most recent edition was published in 2021. Since then, however, there have been a few changes made to the schedule. So, to ensure you have the most up-to-date information, make sure to check the CDC 2025 Child Immunization Schedule. The CDC 2025 Child Immunization Schedule can be found on the CDC's website or accessed on the CDC Vaccine Schedules app. Finally, if you would like to access culturally resonant patient education materials offered by Native Boost, visit www.nativehealthresources.com. Also check out www.indiancountry.echo.org/boost for additional trainings for medical providers working at IHS, tribally run, and urban Indian healthcare facilities. Thank you for watching this presentation. Together, we can increase the number of Native adolescents who are protected against tetanus, diphtheria, and pertussis, and other vaccine-preventable illnesses.